Chapter 19: Fasting in Medicine and Therapeutics. In recent years, fasting has made its way into the field of medicine, emerging as a powerful therapeutic tool for treating various conditions and promoting overall health. While fasting has long been used in religious and cultural practices, modern science has begun to uncover its potential medical applications, leading to new interest in its use in both preventative healthcare and treatment protocols. This chapter explores how fasting is being applied in medicine and therapeutics, ranging from its use in treating chronic diseases to its role in supporting cancer treatments and improving metabolic health. One of the most widely researched therapeutic applications of fasting is its role in treating metabolic diseases such as type 2 diabetes, obesity, and cardiovascular diseases. These conditions are often driven by poor metabolic health, characterized by insulin resistance, chronic inflammation, and excessive fat accumulation. Fasting, particularly intermittent fasting and time-restricted eating, has been shown to improve insulin sensitivity, reduce inflammation, and promote fat loss, making it an effective strategy for managing and even reversing metabolic disorders. Studies suggest that fasting can help lower blood sugar levels, improve cholesterol profiles, and reduce blood pressure, offering a non-pharmacological approach to managing these common health issues. For individuals with type 2 diabetes, intermittent fasting can lead to significant improvements in blood glucose control. By extending the period during which the body is not consuming food, fasting allows insulin levels to drop, giving the body time to reset its sensitivity to insulin. Research has shown that fasting can reduce hemoglobin A1C levels, a marker of long-term blood sugar control, and may even allow some patients to reduce or eliminate their need for diabetes medications. However, fasting protocols for diabetics must be carefully monitored by healthcare professionals to avoid the risk of hypoglycemia, dangerously low blood sugar levels, particularly for those on insulin or glucose-lowering medications. In addition to metabolic diseases, fasting is being explored as a complementary therapy for cancer treatment. Research led by Dr. Walter Longo has shown that short-term fasting or fasting-mimicking diets may enhance the effectiveness of chemotherapy while protecting healthy cells from its toxic effects. This phenomenon, known as differential stress resistance, occurs because healthy cells enter a protective, low-energy state during fasting, while cancer cells, which rely on constant glucose and nutrients for their rapid growth, become more vulnerable to the effects of chemotherapy. Early clinical trials have demonstrated that patients who fast before chemotherapy experience fewer side effects such as nausea and fatigue, and may also see improved treatment outcomes. Another promising area of fasting research is its use in neurodegenerative diseases such as Alzheimer's and Parkinson's disease. Fasting, especially periodic fasting, has been shown to trigger autophagy, a process by which the body removes damaged cells and proteins, including those implicated in neurodegenerative diseases. Animal studies have suggested that fasting may protect against the accumulation of misfolded proteins in the brain, which are characteristic of these conditions. Moreover, fasting may stimulate the production of brain-derived neurotrophic factor, BDNF, a protein that supports the growth and maintenance of neurons, potentially slowing cognitive decline and promoting brain health in aging populations. In the realm of autoimmune diseases, fasting is being investigated as a way to modulate the immune system and reduce inflammation. Autoimmune conditions such as rheumatoid arthritis, multiple sclerosis, and lupus are characterized by an overactive immune response that attacks the body's own tissues. Fasting has been shown to decrease pro-inflammatory markers and may help reset the immune system, reducing the severity of autoimmune attacks. Some studies have even suggested that fasting can promote the regeneration of immune cells, particularly after prolonged fasting periods. While research in this area is still emerging, fasting represents a potential non-drug treatment option for managing autoimmune conditions. In the context of gastrointestinal health, fasting is increasingly being used as a therapeutic tool for conditions like irritable bowel syndrome, IBS, inflammatory bowel disease, IBD, and gastric ulcers. By giving the digestive system a rest, fasting allows the gut lining to repair itself and may help reduce inflammation and symptoms in patients with these conditions. Moreover, fasting has been shown to improve the diversity and health of the gut microbiome, the trillions of bacteria living in the intestines that play a crucial role in digestion, immunity, and overall health. A balanced and diverse microbiome is essential for gut health, and fasting can help create an environment that supports beneficial bacteria while reducing harmful ones. Fasting is also gaining attention in the field of mental health as a potential adjunct therapy for conditions such as depression, anxiety, and mood disorders. Emerging research suggests that fasting may improve mood and mental clarity by promoting the production of ketones, which are an alternative fuel source for the brain. Ketones have been shown to have neuroprotective effects and may help improve cognitive function and emotional resilience. Additionally, fasting has been linked to increased production of serotonin and dopamine, neurotransmitters that play a key role in regulating mood and emotions. For individuals with mood disorders, fasting may offer a novel approach to managing symptoms alongside traditional therapies. In the field of longevity medicine, fasting is being explored as a potential strategy for slowing the aging process and extending lifespan. Animal studies have shown that intermittent fasting and caloric restriction can increase lifespan by promoting cellular repair processes and reducing oxidative stress. Fasting also activates genes associated with longevity, such as sirtuins, which help protect cells from damage and promote healthy aging. While human studies on fasting and longevity are still in their early stages, the evidence from animal research suggests that periodic fasting could play a role in delaying age-related diseases and promoting healthy aging. One of the more recent innovations in therapeutic fasting is the concept of personalized fasting regimens. With advances in precision medicine, healthcare providers can now tailor fasting protocols to individual patients based on their genetic makeup, metabolic health, and specific medical conditions. This approach allows for more targeted fasting interventions, ensuring that patients receive the maximum therapeutic benefit while minimizing potential risks. Personalized fasting protocols are particularly useful for patients with complex medical histories or those undergoing treatment for multiple conditions. Incorporating fasting into traditional medical practice is not without challenges, however. For some patients, prolonged fasting can lead to nutrient deficiencies, electrolyte imbalances, or complications related to underlying health conditions. As a result, healthcare professionals must carefully monitor patients who engage in therapeutic fasting, especially those who are elderly, pregnant, or have pre-existing medical conditions. Despite these challenges, fasting is increasingly being recognized as a valuable tool in the therapeutic toolkit, offering a natural, non-pharmacological approach to health management. In conclusion, fasting is no longer seen solely as a religious or cultural practice, but as a legitimate therapeutic intervention with a range of applications in medicine. From treating metabolic diseases and cancer to supporting mental health and longevity, fasting is proving to be a powerful tool for promoting health and healing. As research into the medical applications of fasting continues to grow, it is likely that we will see even more innovative uses for fasting in therapeutic settings, providing patients with new options for improving their health and well-being.